Sue Ashton,
Here.
Heidi Bassford Kirkhoff,
Here.
Claude Benedict,
Absent.
Lurton Blessingame,
Absent.
Ron Durkop,
Here.
Sandy Kleckel,
Here.
Julie Maslowski,
Here.
Judy Ritchie,
Here.
Deb Allison Asby,
Okay. And next on the agenda is the approval of the April minutes. You have those before you. I think there's a couple of minor corrections. Fine.
Yeah, I have one, it's just a correction on page 2. Under other business, the second bullet point, the word should be introduced instead of passed. We hope it would, I'd like to see it passed, but so far that bill has just been introduced, the Credit for Caring Act. So,
Any other additions or corrections? If not, the minutes stand approved with corrections. Citizen statements. Do we do a motion? Okay. Okay, a motion to approve the minutes with the correction?
So moved.
Second, anyone?
Second.
All those in favor?
aye.
Opposed? Okay, and they're approved. Next, any citizen statements? Either Julie back there? Okay, thank you. Then we will move on to our new business, which is Sandy Tollan from the Public Library. Sandy?
Good morning, everybody. Judy, thank you
Morning.
for inviting me and the library into your meeting today. We'll be talking very briefly about the home delivery. I know that Judy made a handout and gave it to everybody, but we'll also touch on other things that the library is here for you as people on this committee and the people with whom you work. So your community library, a partner in lifelong learning. Home delivery, this is one of the main things that people think about when they think about the senior population in libraries. And the nice thing about this is that we can bring whatever you want. One of the best ways to stay connected in a community is to be engaged. Pop culture is really important, reading is important. We have fiction, we have nonfiction, we have magazines. If you were really interested in music when you were 16, you might still be when you're 76, and we can bring you CDs. If you were a gearhead when you were 20, we can still bring you auto books, we can bring you gadget books. We can still connect you with the interests that you had when you were still allowed to move about. Another nice thing about home delivery is that we're not going to ask you for your BMI, we're not going to take your blood pressure. You call and say you want things delivered, and we do. It's as simple as that. We have about, say, 7 volunteers who regularly visit the people with whom they deliver the books. The delivery happens like the milkmen of yesteryear. It can be a once-a-month thing. It comes in a bag. You put the bag out the day before. We change it out, and away you go. Some people want to be more engaged with their reading. They want to pick the specific authors. They read about something or saw something on TV, and they want to learn more about that. So they can call me directly. They can email. Some people put little notes in their bags. So it's a communication and a friendship the whole time. It's not just you're getting these and you have no say in it. So you still have agency in your interests. Another thing is you don't get any fines. The reason you don't get fines is because you're not the agent who's moving the books. We're bringing the books to you. Somebody else is picking the books up. Sometimes things will get lost in somebody's car. That happens. You also get them for 2 months as opposed to just the 1 month. So there's a lot of benefits to getting home delivery. There are no fines within this program, like I said. Folks on home delivery can still request titles and authors. Another thing that's really nice in this program specifically is if you've read Palaces for the People, you've heard about the social network, the fabric that keeps people connected. Many of the volunteers become friends with the people they see on a monthly basis. They come in, They talk for maybe 5-15 minutes. Did you like this selection of books? Something happened in between the month when I came last time. Maybe your granddaughter or grandson came and visited. So we're still creating that social connection, which I think is really important in the library, specifically in the community. So it's not just a hands-off sort of thing. There's going to be another person there in that person's life that they can count on. The books can be monthly, or it can be you call every 6 weeks and you want this particular book. So I really want to emphasize that there's no structure, because we want to make sure that it's comfortable for you. Now, some people will start with just, I just want these 2 books because I can't read more than that. We're not asking for book reports. So if you get 4 books and you don't like 2 of them, put them back in the bag and don't read them. So there's a lot of people will get nervous about wanting this home delivery. They don't want to put anybody out. That's what the volunteers are for. So let them have something to do by coming and delivering these books. We already have the service in place, so if you ever hear anybody saying, I wish I could go to that movie, I wish I had this magazine, I'd like to know more about the Titanic, connect them with me, connect them with the library. Some people get home delivery just because they sprain their ankle, so they get it for 2 months, then they're done. So it's not a full-time commitment. The world doesn't fall apart if you decide you don't want to get it for the summer because you have kids around or something like that. We could just be snowbirds with you. So it's as easy and welcoming as we want it to be, because we want people to be connected to the library. Are there any questions about this?
Are there any restrictions for those you deliver to? No, none.
Nope. It's free, just like anybody who has a library card. There's even less restrictions because you don't have the fines and you have a little longer time. We can get things in large print. We can get audiobooks. We can't get ebooks. So sometimes people will hear a title and it comes out as an EPUB first. If that person has a device, we can download it for them. But if it's something that is just an e-publication, we can't give them an iPad. Does that make sense? But we have ordered CD players for people so they can listen to books with audio. So we have tried to meet those tech needs when necessary.
I work at Bella Vista, and we use this program often. And
Yay!
Yeah, and it's wonderful. We just have the residents fill out kind of the genres that they like, and you guys do a fantastic job filling them. So great job. Thanks.
Thank you, sponsor. You didn't get paid for that. When people want to get home delivery, I try to go and visit them specifically. What TV shows do you like? What authors do you like? What do you like in a story? Do you like the sweeping vistas? Do you like Stephen King that uses 500 words to say 20? Do you like really short things? Do you like Nicholas Sparks? Are you more pulled to news shows when you're watching TV? So all of this is kind of a litmus test of what types of books you might like. The really important thing that I enjoy is, let's say that you really read James Patterson, you love James Patterson. You might not have the ability to browse and meet other authors. So we have a database that anybody can use through OshkoshPublicLibrary.org called Novelist. And it's a really strong database that will let you say, I like James Patterson. It'll pull up 12 other authors that read like James Patterson. So maybe you're not able to get the newest James Patterson, but we can give you some things and broaden your interests and broaden your scope of reading by introducing you to a couple different authors. So home delivery, here's some other things specifically for seniors or just adults. A lot of people think the library is really important. I have a 6-year-old, I need to teach them to read. But actually last year we had more adult programs than children's programs. We're really focusing on bringing adults into the library, creating and fostering community. We had a program 2 years ago that was about cheese. It was cheese making. 8 people came, and afterwards they all went to Bar 430 together and had wine and talked about the cheese. That's building community. It's also getting people excited about cheese, which isn't hard to do. But that's why there's a lot of different little niche programs that we're now offering for adults, because you might be interested in beekeeping, but you might not know anybody in the community that's interested in beekeeping. If we bring people who enjoy beekeeping together, now you have a resource locally that you can connect with and you can foster that hobby. We also have Book A Librarian. Book A Librarian, let's say that it was your birthday and your niece or nephew got you a new iPad. You don't want to read all the directions and it seems kind of daunting because it's brand new to you. You can call that number, which is 236-5205, and set up a one-on-one time with a librarian who will help you with the steps you need. Maybe it's not using your iPad, it's finding databases on your iPad through the library. Somebody can make an appointment and you can go in and you can ask those questions. This is really nice if you're somebody who you find yourself being kind of shy if it's in a group setting, or you don't want to wait for that next installment of Tech Tuesdays that we have. You want to know this information right now. You get at least a half hour. You can definitely make multiple appointments, and it fits around your schedule. So maybe 1:30 in the afternoon isn't good for you. We're open till 8 o'clock. Maybe you can make that appointment at 6. Maybe you can make it on a Sunday when we're open. So this is a great way if you're looking for just that, I just don't know, you can come to the library and they can help you with that one-on-one. Like I said, we are having a lot more adult programs. These are just a sampling of the 3 routine programs that we're having. The What's Cooking Cookbook Club is going to be the tastiest thing you ever do every month. It's the second Wednesday of the month. This month is going to be May 15th, and they're doing family favorites. Your family likes spaghetti, bring some spaghetti to pass. Your family likes BLTs, fry up that bacon and bring it on down. There's at least a 10-person core group in that club. They talk about what they've made. They talk about where they found the recipes. There's a little bit of trivia. Again, it's that building community. Maybe you live alone and you don't have people to make appetizers for. Well, you can come to this club. You can share that. You can share your joy of cooking. That's the second Wednesdays of every month starting at 6:30. Considerations is our monthly topical discussion group that meets the second Tuesdays of the month. This month is May 14th, and we're talking about legalized marijuana. There are 33 states in the U.S. right now that have laws about marijuana. Where is Wisconsin going to stand? What are the pros and cons? Living in the community that we do now, it's very easy to get information from the BBC, to get stuff from CNN, but do you know what your neighbors think about different topics? Do you know what your coworkers do? We've partnered with the Civility Project in town with this, so we can have civil discussions. We might be on polar opposites of the topic, but we're going to hear each other and not yell over each other. The library also vets the articles, so if you go to oshkoshpubliclibrary.org, there are 4 articles to base our discussion on that. So then you're getting vetted, reliable, verifiable information, which is the cornerstone of what the library does. So that will be next Tuesday. I expect to see you all there at 6 o'clock. There's cookies and coffee beforehand. Adult DIY is exactly what it sounds like. It is do-it-yourself. There is going to be Tuesdays, the second and fourth Tuesday. They've made wreaths, they've made succulent pots, they've made jewelry. It's free. The library incurs the expense, or we find community enthusiasts who will just come in and show their trade. You have to sign up, so call the library and register for the adult DIY. Tonight, we're having the Herald, the editor of the Herald, being at the library talking about starting a local paper. It's 1 year in. What are her plans? Is she where she wants to be? What are her plans going forward? Has a community paper had an impact on the community? So that'll be at 6 o'clock tonight under the dome. If you haven't been there, it's a beautiful place. A lot of these programs came because we heard people saying, wouldn't it be cool if? One of the nice things about a library, I think, is that it's a direct conversation between the community and the institution. So if you're interested in something, wanting to know something, tell us, and if you're thinking about it, there's probably at least 5 other people in the community that are thinking about it. Let us put together a program to help you with that information gap. Another great thing about the library is finding value in the community. Volunteering is really important for a multitude of reasons. I'm the coordinator of volunteers, so I need to plug this right now. There are 3 great things about volunteering. Connect with the library, and the opportunity in a special way. Give the time you have. You can volunteer weekly, monthly, or just as needed. I have probably 10 volunteers that come in on a monthly basis. I have 60 that are just part of the volunteer corps. You get an email. If it works with your schedule and your interests, say yes. If it doesn't, just delete it and you'll get another one. So you can still be engaged, but you can still enjoy that retirement time if you have that, and allow yourself to go on the trips that you were planning. babysitting your grandson or granddaughter, but still being able to be connected to something bigger than yourself. Our home delivery volunteers, they're all volunteer. One guy goes to a dozen different places. He spends 4.5 hours one day because if he's going to volunteer, he wants to make an impact, and he does. If he left, there'd be a whole bunch of people not getting their books the next month. If you're interested in volunteering or know somebody that would be interested in volunteering, you can fill out an application online at oshkoshpubliclibrary.org or call me 235-2506. 235-5206, that's what those words are. Brain health is another big thing that people are considering right now. We have a lot of books about how to keep your brain engaged, keep it active, keep yourself new and young. Being your partner in long learning, we have Gale courses. Gale courses are online. You sign up for a 6-week time. You can learn about having your own craft store, introduction to philosophy or photography, the importance of psychology, aging and health. There are a multitude of courses you can take that are free under Gale courses. Mango languages, you can learn sign language through Mango. You can learn Polish, you can learn German. If you want to connect with your ancestors, if you're doing ancestry and you need to understand what is written in those records. If you're just wanting to go to Portugal and you want to learn Brazilian, you can go to Mango languages. Again, it's free. Ancestry is the really powerful genealogical database. We have that in-house. You can come and use our subscription so you don't have to shell out your own money for that. It's the same subscription. Hoopla, if you have a laptop, if you have an iPad, if you have a phone and a library card. Hoopla lets you download graphic novels, TV shows, movies, audiobooks, and EPUBs. It's absolutely free. Stop paying for Audacity, use your library card, and support your public library. And finally, the Friends of the Oshkosh Public Library is a special way to engage with the library. It's the fundraising arm of the community library. They help with volunteers, they help with the summer reading, they give financial support to our other giant programs, Grinchmas, they give money to that. So if you're interested in volunteering as a friend, if you were a HR person in your regular life, or if you were a graphic designer and you still want to keep up on your skills, if you had some marketing background and you still want to use that, this would be a great nonprofit to really sink your teeth in. Again, you would give me a call. And you have the spring event guides in front of you. This is the programs for all ages. Through May, there's still plenty of stuff happening. Our summer reading kickoff will be June 7th. It's a space theme this year. I hope to see everybody there. It's an all ages thing. Thank you very much for offering me this time. Does anybody have any other general questions about services or ways to use the library?
For the Oshkosh home delivery book program,
Mm-hmm.
do you basically stay within the city of Oshkosh, or do you go out to the surrounding areas?
Good question. The program is just at the Oshkosh Library right now, but I have connected with 2 individual libraries in the Winnifox system when somebody has wanted home delivery and it's outside of our system.
Okay.
So it has worked on 2 occasions. I can't say that it always will, but I'll do my best to make sure that we can do that if we can.
I may have missed it, Sandy, but how many people are currently using the home delivery service?
106 people.
106? Okay, great. And mostly elderly or physically disabled, whatever?
Mostly, but again, I wouldn't turn anything down because if you've decided that this is the easiest way for you to get materials, then that's the way that we're going to interact with you. Yeah. We also have book club kits. Book club kits. There are 10 books in them, a large print book, an audio book, discussion questions. So at Bella Vista or any other senior living facility, if you wanted to have a book club and not have to find all those books, if you go to oshkoshpubliclibrary.org, you can find for readers, there'll be a list. Now maybe the book that you're looking for isn't on that list. I would send a request to the reference department or call them and say, we would like to see this. And more often than not, they'll put that list together or that collection together for you.
I'll make a comment positive both from the volunteer side and the recipient side. Going back to when I was still employed with Meals on Wheels, I had a couple of my clients who were utilizing it. Phyllis had one complaint, and it really wasn't a bad one, other than she's such a voracious reader that she couldn't always get the newest titles as quickly as she would have liked.
We all feel that way for a voracious reader.
Right. So, for her, it was, I'm not sure if the books were more important or the visit with a volunteer, because the volunteers always stayed and chatted with her longer than what they normally would do. And then one of my volunteers also volunteered, and I saw her just recently, and she said that she gets so much more out of it with those visits, and she makes it a point now to read some of the same books as one of the people that she delivers to, because then they've got that additional conversation. And she always puts that lady where she's got more time. So
That's a fantastic
the
story.
connections that are made, there's no value you can put on it because it's priceless.
In my view, the books are completely secondary. It's that connection that we're making, and the books are just a vehicle. So I completely agree with you. And to Phyllis's complaint, we now have, you can go to your preferences under your account. If anybody needs help with that, you can call the library and get that. And if you have special authors that you want everything from, you can click those boxes, and you'll be automatically placed on the hold list for all of their new things. So
I will
you don't
email her.
have to, yeah, I finally got your attention. I saw that. So you can go there and you can say, I'm going to get every Patterson, I'm going to get every Isabel Allende. Just click that, and then it just comes to you and you get notified.
I'll give her an email later today.
Fantastic.
Thank
Thank
you.
you. Thanks, guys, again.
Thank you.
Thank you.
Okay, moving on, our group reports. Lurton is not here to do strengthening our partnership with neighborhood associations and other partners. We gave Bobby a couple of sheets. He gave us a script of what he does when he meets with the neighborhood associations. And he talks about, with this particular one, he was talking about the quick tip guide to the Aging and Disability Resource Center resource guide. So talked about that. And then he listed 17 different resources that included the tip guide, the advanced directives, the United Way Employment, 211 United Way Employment and Help Guide, transportation programs, fraud, disabled parking identification, permit information, the invisible disability disclosure, the I am deaf, hard of hearing card, visor card. So he's getting a lot of good information out to the neighborhood associations that we bring to this committee. So I really have to thank him for that, because neighborhoods need that. We're not always getting out to those individuals. So that's the report we had. And I'm going to have Bobby scan these 2 pages and include that as emails to us. Improving access to affordable transportation and delivery services for seniors. Our work group has not met recently, but I've had a couple of comments about people are seeing a lot more of the Eat Street and other meal delivery vehicles out in the community with their signs on top of the car or whatever. Anybody else have anything that would be on either of those subjects? Okay. Creating community design and policy that supports an age-friendly community. Jean is not here. Did she have anything that you're aware of? Okay. Improving communication and visibility of available services to seniors. Right?
Let's see, I got several things here. On April 13th, we were represented at the Unity in the Community event at the convention center. Heidi and Judy and Lurton and I think that was all of us who spent time at our booth, and it was a good opportunity to be visible in the community, which is one of our goals here, and improving communication. We had a chance to network with other entities that were present,
And learning about other cultures.
learning about other cultures was really a fun time, and I think there was a very good turnout.
Yes,
This is
there
the
was.
second annual, and I don't know, I wasn't at the first, so how it compares, but there were hundreds of people there, and lots of good food to sample. And
Mayor Cummings was very happy with what he was seeing.
Yeah, and this one was held indoors. I guess the first one was
Yes.
outdoors, and it was a
Right.
good thing, because it wasn't a great weather day to have it outside, but it was, I think it was well worth our being there, and we handed out lots of information. I think the Durable Power of Attorney for Healthcare and Finances was one of the leading documents, again, as it has been in our past two.
And the resource directory.
And the resource directory, sure. So, thank you for all of those who are participating at this event. Another is the Oshkosh Senior Center has a resource room, and I know we've talked a little bit about that in the past, but I'd like to highlight a couple of the publications that are available in that resource room. One is help for agents under a power of attorney for finances, the focus on finances. And it's really geared to those who are managing funds for someone else, and what their fiduciary duties are, and how to keep records and meet their responsibilities as a power of attorney for finances, for example. A representative payee would fall into this category. A guardian of estate technically would fall into this category too. It's a really good publication, and they are available in the resource room. And I'm going to just pass that around so you can take a look at it. Just the last couple of months, I think these two were available. The other is Money Smart for older adults. It's a resource guide. And if you want to know about scams, the ins and outs, and how to avoid them, how to be alert to them, this is the book for you. It's like 99 pages long, and talks about common types of elder financial exploitation, which is a huge problem in our culture. One area is avoiding telephone and internet scams, another debt collection scams, avoiding charity scams, computer internet scams, identity theft, medical identity theft, unexpected life events, scams that target homeowners, scams that target veterans. And it's well done, and another one that people should be aware of, and can be picked up at the Oshkosh Senior Center in their resource room, just off of the reception area to the left as you're coming in. And the final would be an event that's coming up on the 13th of this month, called the 2019 Dementia Summit. Were you going to talk about that later, or is that?
Karen is going to.
Okay, all right. No.
It's just FYI, letting
Good.
people know. So.
Good. Well, why don't you go ahead, and I'll
Okay.
fill in if I.
Well, yeah, like he mentioned, there is going to be a 2019 Dementia Summit, and that is basically, we're working with the dementia specialist at the ADRC
Right.
to try to build more of a infrastructure for businesses within our Winnebago County community to be able to work with people who may have dementia or family members who have dementia. So it's a summit. It goes from 7:30 a.m. to 9:30 a.m. It's a breakfast. It's going to be at the Oshkosh Convention Center. There's going to be 5 panelists. So there'll be the dementia care specialist will be speaking, as well as there'll be Jody Craner, who is a dementia diagnostic clinic manager, Todd Raggy, who's with the Oshkosh Police Department, will also be there. Oliver Zorno, who is a community engagement manager. So he's going to talk about the Spark program that comes out, that's going to be offered here in Oshkosh. And then there'll also be Kate. I'm
Man,
Kate.
just Kate. I'm going to
Oh.
mutilate the last name. But she's a dementia caregiver, so she's going to give her perspective on what it's like to be a caregiver. And so this is just an attempt to kind of talk with businesses and make them aware of dementia in an attempt to make a dementia-friendly community. So,
great,
Yeah.
thank you. Well done. You covered it.
Anything else under that?
None under that, no, thanks.
Okay. Okay, moving on to other business. Sue, the state dementia plan?
That's a good segue into what we're talking about here. Wisconsin's state dementia plan is a 5-year plan from 2019 to 2023, and they are just looking at dementia overall, and they just want to improve the care that people get and help them with different things. So I'll just read you this little statement here. Alzheimer's disease and related dementias are already straining Wisconsin's long-term care system. And we all know that. And it increases dramatically in the future because of the baby boom generation. Department of Health and Human Services is committed to working to change the way that state residents with Alzheimer's disease and other dementias are cared for in our state. And the mission is to provide appropriate, safe, and cost-effective care throughout the course of the disease. And then there are just some key components here. Number 1 is to increase community awareness. Number 2, facility-based long-term care. They're looking at that. Number 3, crisis response system. Number 4, guiding principles and training. And number 5, research and data. So it's quite an extensive plan. You can go online and check it out if you want to, but I think that's a good thing that they're doing this. So it improves the quality of life for the person, minimizes the public and the private costs to the individual. And it says in our state, there are right now 110,000 residents aged 65 and older who have had Alzheimer's disease in 2018. And they are predicting for the future, because of the baby boomer generation, that it will increase in 2040 to 242,000. So in effect, that's like doubling it or more. So they're just trying to plan for the future, which I think is a good thing. And if any of you have had family members with Alzheimer's, you kind of understand. My mom died 10 years ago now, and I'll tell you, we had a very good doctor here locally, a Dr. Cooper, and I took her from Racine to see Dr. Cooper. She was very understanding and very helpful. The one thing I didn't like, when you went to see the doctor, they would examine, the person you bring in and talk with them, but then they're sitting right next to you, and then they'd interview you, the person, the caregiver, about how's this person doing. Well, if you're honest with the doctor about how they're failing in different areas, when you walk out the door with your mom or your dad, they're angry with you, quite angry with you. So I think that really needed to be improved. Whether it is or not, I don't know, but it sure needs to be looked at. And in the future after that, when she was so angry with me, I wrote my notes and gave it to the doctor as we talked, so that I wasn't going to have to deal with that, in the future. And then she left the area, and I had to find a new doctor. Well, good luck with that. There wasn't nobody around here. So then I took her to Fredert, and that was a huge mistake. That doctor was a young female doctor, and she could care less about my mom. And I walked out of there after the first visit, and I said, we're not coming back here. I mean, there's just no care. Just physical things. That's all they really cared about, nothing else. And so that's huge. So I'm glad they are working on this, because it is a problem,
I'm going to just interject for a second. You, as a retired nurse, if you're voicing that type of frustration, can you imagine what it's like for the average person out there? They don't even, a lot of the people don't even know the questions to ask, have difficulty processing what they're hearing. And you were willing to be your mother's advocate, whether she got angry or not. Many times those families will back off, and they're just waiting for a crisis to happen, so they don't have to be the bad one. So it's my perception of what I'm seeing a lot today.
So I'm just really glad to read about this, that they are, and actually they are, one point, they are working with the healthcare providers, because they know that they have to learn more about these things. I remember at one point, the doctor ordered this medication, and I asked my dad what it was, and he told me. I said, well, don't give her any more of that, because it was really for a mentally ill person that had like bipolar or something. It was not for a person who had Alzheimer's. So there again, Judy, it's like, if I didn't know these things, let's just put this person away, It's just, whoa.
Yeah.
So I'm really encouraged that they're looking in these areas to try to help doctors learn more about it physically, emotionally, and including the family. So those are all huge. So basically, that's what it is in a nutshell. And you can go online to look at more of this plan, because there's pages and pages of it. They're also looking for volunteers to help out. So you can call the ADRC, and the number here is, let's see, it's supposed to be right on here. It looks like it's 886-2372, 886-2372. Or you can go online to ADRC at co.winnebago.wi.us. And look up the Aging and Disability Resource Center from there. And if you want to become a volunteer, there's certain questions that you answer in 5 to 10 minutes, and you can help with some of these things around the state, in your area, wherever you are. So it's a good thing, very positive.
Sue, do you know if there's any emphasis in the plan on good diagnostic resources? Dr. Cooper was the
Right.
leader, if you will, at least in this area for many years, while she was here, in terms of helping there be good diagnostic services. And I'm just wondering what we have today, and maybe Aaron has some information on that, in terms of where would people go other than, to their general practitioner, who then hopefully makes good referrals to neurologists and so forth. Are there anyone specializing in that area in the Fox Valley that we know of? Or is that a huge unmet need?
No, there are, a lot of times people will start out with their primary care provider.
Right.
So that's like the first step.
Sure.
From there, a lot of times may be referred, it depends on the system, but I know like neuroscience will do some evaluations to
That's in Neenah,
diagnose.
correct?
Yes, that one is in Neenah. So I know a lot of people go there.
Okay.
I don't have specifics
yeah,
in front of me,
sure,
so I
sure.
don't want to say one way or the other.
Yeah,
I mean,
okay.
other systems have, every system, I do think the awareness is out there, and I do think doctors are thinking about it, and people are obviously being diagnosed. So, yeah, I think you start with your primary care,
sure.
and from there, they kind of work with their systems.
And I would say if your primary care isn't really that involved or doesn't
Yeah.
seem to care, I would look for somebody else.
Yeah,
Right.
Because that is really paramount. She had
I
a,
agree.
family doctor who really wasn't very
Right,
caring.
I agree. And a lot of times in the 15-minute visit,
Yeah.
they're not going to see the whole picture.
Right.
So you do have to advocate for your loved one. And, if the provider's not really taking you seriously, go find another provider.
Yeah.
So,
Well, the word denial circulates through this whole dementia arena in terms of people not wanting to believe that their loved one has the dementia, or the person who's having some cognitive issues, wanting to believe that they might. So, I mean, the tendency is to wait too long, or longer than one ought to actually get into that whole diagnostic pursuit, if you will. So,
But it's really slow, and the family doesn't really realize it's happening.
yeah.
I mean, with my mom, the reason we found out more so, because, she lived in another city from me.
Sure.
And she said like a Valentine's Day at Easter to my daughter. And we're like, what's that about, And then when I would come to visit, she would say, would you go over my checkbook for me, because you're so much better at this than I am. See, there she was slipping. And we didn't pick it up, until these more blatant things would happen. She said something when we were all together one time at Thanksgiving, and we all looked at each other like, whoa, and so it's a real slow process, and it ekes in, and it's very slow, and you don't put it all together.
Sure.
And then one day it just happens, and then you know for sure,
Absolutely.
It's hard.
I know in our case, my dad had vision problems, macular degeneration that was progressing. And so a lot of the skills that he was losing, we attributed to the loss of eyesight. And it wasn't until a couple other things happened. And it was like, okay. And even then, my brothers were in denial, even more than I was. And because, like I said in the beginning, I was my dad.
Yeah.
Right.
And I could see it with other people, but I couldn't with my own dad.
Right. It's different when it happens in your family.
Right.
Yes, it's totally a slow decline in here and there, and then you finally put the pieces together. But it's been going on a while, and you just have not seen it or done anything about it, because you don't really want to believe it either.
Right.
And
You don't.
one of the other signs, and there's been a few things that are of great help these days, is with the driving. And as the driving skills diminish and getting lost, there is the, I forgot what it's called, Safe Driving Program, something, with Aurora. And they do, it's out at Doctor's Court, and they can do a simulator test. And I'll get you the information, Aaron.
Okay, good.
I'm actually going to try to get a speaker from there. But they do a simulator test, they do questions, and depending on how the individual scores, they then, in conjunction, and that has to be doctor's ordered. But then in conjunction with the doctor, they can then insist on an on-the-road test. And if the person, they can give some limitations from there, but then the on-the-road test with DMV, and from that, either they can continue driving with limitations, or they can have their license revoked for the safety of themselves and others. We also have the silver alert of individuals who go missing and looking for them in their vehicle. And that started with a couple from up north trying to drive from their area to Green Bay, and were found down in West Bend. And so there's all those kinds of things, and they're slow to happen for us, but they're out there, and they're protections for everybody.
There's recently been a radio advertisement on, I don't know what channel, but it talks about a son having lunch with his mother, and he misses 3 of the warning signs of dementia. And I thought that was a really good public awareness piece to get you thinking about maybe that is happening, so just wanted to bring that up.
And driving is a hard issue, even if you don't have Alzheimer's as people age. I've seen doctors actually they say, show me your driver's license. They'll take it away and put it in their pocket. And that really angers people.
Oh, yeah.
So there's different ways, to curb that. Wow.
Well, but taking it and putting it in the pocket does not
Right.
actually limit them from driving. They'll just drive without that
Exactly.
card in their wallet. But there are a lot of things that can be done to bring those driving concerns out in the open, to have that person screened, and to either, allow them with limitations or to revoke that license. And there's everything from an impaired driver report that the police can do. There is an impaired driver report that a family member can do. And if they're going to do that reporting, along with that is a statement of confidentiality that gets filled out and signed in front of the DMV official before you even discuss it. And that form gets handed over, and then and only then do you present the other report. And that was brought to the Caregiver Coalition several years ago by a DMV official who came and talked about safe driving. So there are things that a family can do. As Sue knows, as a lot of us know, working with those impaired individuals, they get very angry when you point out those concerns. So we have to be very discreet about it. We have to be very careful that we're not overstepping our bounds, but we also have to look at the overall safety of the individual and others. And I think, Julie, you see it every day with the folks that you work with. And how does your staff deal with some of that, or the families? This Julie.
Well, I guess, if you want to speak to it.
This Julie.
Well, actually, Julie does home care.
Yes.
If you want to step up to a microphone and
Sure.
how you train your staff to work with these individuals. Julie, is for the business part of our meeting here, state your name, please, and the
Okay.
agency.
I'm Julie Davids. I'm the owner of Home Care Assistance, and we work with a lot of elders that are going through the transition of having dementia. The average time it takes from the disease is between 10 and 12 years that it starts. So how do we train our caregivers? For example, this Friday we're having Becky from the ADRC come, and she's going to do what is called, I think it's something called the friendly dementia. So she's going to talk about how to approach people who have dementia, what to do in certain situations. And she'll be coming this Friday from noon until 1 to go over role-playing and situations where our clients have difficult behaviors, and how we can train our caregivers to approach them, redirect them in a peaceful way. So that's what we're doing. If any of you are interested in attending, you're welcome to. Even though it's for our caregivers, you can come to that.
Okay, thank you. And other Julie?
We have specialized training, much like home care assistants. One other piece that we add to it is we have a virtual dementia tour that we send our caregivers through. And what that kind of looks like is we limit some of their senses and enhance some other ones, so it simulates somebody that has dementia, so they understand some of the things that they might be experiencing when they're going through a difficult time, how to approach that individual. It really kind of puts you in that, what they're feeling and what they might be experiencing. If anybody would like to ever go through it, I went through it, and it was a very moving experience for me. And I think, anybody that works or is a caregiver for somebody with dementia should go through it just to have that better understanding. And
Julie, I'd like to add that I did that
Yeah.
several months ago, and it was really eye-opening in regards to the limitations of sight and dexterity and,
Right.
you know, being able to walk around and hearing. The
Yes.
hearing was really the hardest, and
Yeah.
having to try to complete tasks, and
Yep, I
couldn't
found-
see what the tasks were.
Yep.
So
And I found myself mumbling to myself, trying to figure out what I was doing, and
Right.
you know, you really understand a little bit better. And so I would invite anybody that would be interested in doing this virtual dementia tour to reach out to us, because we'd be more than happy to share that with people.
it was excellent.
Mhm.
Highly recommended.
Yep.
Well, and I think just this part of the discussion, which expands on that whole state plan, we've got a lot going on in our community to help with the families to experience, you know, at this point, this one and that one don't know what it's like to go through the experience that you have. All these things, we're ahead of a lot of communities in that respect. And that's something to be proud of. In the fact that we, as a group, collaborate so that we're not duplicating a lot of things, but we're all working on the same mission. So I think we've got a great deal to be proud of and need to share that information. So we're going to move on a little bit. Older Americans Month, May is Older Americans Month. It was established in 1963, and about at that time, there were like 17 million living Americans that had reached their 65th birthday. We're far beyond that number today. And a third of the older Americans lived in poverty, and there were few programs to meet their need. And so in April of 1963, there was a meeting with President Kennedy and members of the National Council of Senior Citizens, and they began designated May as Senior Citizens Month, which then became Older Americans Month. And it recognizes the number of growing the proclamation, the number of growing Americans, the commitment to strengthening our communities, and it goes on and on. But Oshkosh is doing a great job. Oshkosh and Winnebago County. And again, something to be proud of. And Julie?
Yep. So one other thing, WBAY just did an investigative report on Medicare scam calls that are going out. The AARP Fraud Watch says scammers are calling seniors and telling them that they can get a plastic version of the Medicare card. The scammers ask for personal information, of course. All Medicare cards are paper. There are no plastic versions that exist. So if you get a call about this, just please hang up right away.
Did you have anything else?
Yes,
you
yes.
do.
So at Bella Vista, we start our concerts on the patio on May 15th at 5:30. So it's the third Wednesday of every month. It's out, like I said, out on our back patio. We have refreshments and appetizers available. But it's a really nice night to get out and enjoy the nice weather. Last year, we had no rain dates, and even if we do have a rain date, we'll just hold it inside. So feel free to come out and enjoy a nice night out on our patio.
Thank you. Heidi? Do you have anything?
I do not.
Do anything else? Ron?
One other thing, and this has to do with observation status. It's a status that people are sometimes put on once they're admitted, or not admitted, but in a hospital, and they're not admitted. So if they were to be moved then to a nursing home, there's a big problem with payment, Medicare paying for their care in the nursing home. Well, in late March, a federal district judge denied Health and Human Services attempts to halt a nationwide class action suit brought by Medicare beneficiaries seeking the right to challenge their classification as observation status in hospitals. Although care provided to patients on observation status is often indistinguishable from inpatient care, it does not count toward the 3-day inpatient hospital stay required for Medicare coverage of skilled nursing facility care. Individuals who brought this suit were forced to pay up to $30,000 out of pocket for their post-hospital skilled nursing facility care because of their classification as observation. Trial is set in this case tentatively for August 12th of this year. And the information is coming from Justice and Aging and their pro bono partner Wilson Sonsini, our co-counsel in this litigation, led by the Center for Medicare Advocacy. So we'll kind of keep following this. Hopefully that can be overturned because that has messed with so many people.
I agree. We see a lot more respite stays at Bella Vista because they're being denied that stay at a rehab facility or skilled nursing, and they can't go home yet. So we do a lot of respite stays because of that now. Mm-hmm.
And the thing of
That's
it is, sometimes the person that's hospitalized has no idea that it's observation only
Exactly.
until they're moved, and then
Right.
they find out, what?
Yeah.
And what can they do about it?
Not a thing.
Yeah, they have no
Really?
recourse. Yeah.
Right. So one of the things that people can do proactively is once they are in the hospital to really pursue, am I admitted or am I on observation status? And if it's observation status, they need to challenge that with their doctor and
Right.
see if they can or be transferred to a admitted status. And as it says, often the care they're getting is the same as it would be. Yeah.
Absolutely the same.
Yeah. So, okay, more to come on that.
And it points out the need for every one of us at whatever age, when we're going to the doctor, when we are admitted to the hospital, when we're at the hospital, to have someone with us to be our advocate. Because when you hear things you're not necessarily comprehending, and it doesn't matter how
Yeah.
intelligent, how alert we are, when you hear certain words, the brain just freezes.
Yeah.
And we don't ask the questions that need to be asked. And the other thing is, have a tape recorder handy. Because then you can listen and re-listen and re-listen and hope that you're absorbing it.
Yeah, good advice.
Anything else?
No.
Anyone else have anything? Okay. Our next meeting date is June 4th here, and we're in the process of confirming our speaker. So with that, I'll take a motion to adjourn.
So move.
Second?
Second.
All those in favor?
Aye.
Aye.
Okay, thank you. Meeting adjourned.